According to the World Health Organization, WHO, urinary incontinence is one of the last medical taboos. Worldwide, there are more than 200 million people affected by incontinence. Only a fraction of them is in medical treatment. Main reasons are shame, fear, and doubts referring to the current therapy offered. Transpelvic magnetic stimulation, TPM, with the pelvis center. Science, high-tech German medical technology perfected. Modern design for your doctor's office. An important, innovative therapy option for incontinence therapy. It has never been so easy to treat a disease of the genitourinary system. No need to undress, no degrading exposure of the genital area. Very comfortable and without pain or embarrassment. By simply plugging in a program chip card, the therapy program starts. The therapist can decide at any time about the level and the intensity of therapy for the pelvic floor. By means of capacitor and patented coil technology, the magnetic impulses are deflected vertically upwards and focus deep into the pelvis. The patient will feel a stimulating pulse and tingle in the buttocks and pelvis. The focus is the pelvic floor, a complex architecture made of visceral ligaments, fasciae, and muscle layers. If the tone of the pelvic floor muscles is weakened, the bladder and with it the urethra can barely be controlled by means of muscle contraction. Result: the urethra hangs downwards like the mouthpiece of an empty balloon. The urethra can no longer close properly. The result is typical stress incontinence. The high flux density of the magnetic coil creates strong action potentials in the motor nerves of the pelvic floor. With this, the muscles are contracted rhythmically, much stronger than is possible with active physical training of the pelvic floor. After just a few treatments, you can see a steady improvement. So in case of any pressure rise in the abdominal cavity, the vagina and the bladder lying on it will be pulled back and downwards, at the same time also forwards to the abdomen. The urethra will be stretched, that means narrowed and bent. The result is an effective and greatly improved closing of the urethra. According to the integral theory of Petros, the pelvic floor functions like a stretched trampoline. If this trampoline loosens, the vagina loses its clamping ability and the bladder floor sinks with fatal consequences. Now, the receptors for the fill level rub against each other and create a lightning thunderstorm of wrong information, which the brain will answer with micturition. By means of stimulation of the pelvic floor muscles, the trampoline will be tightened again. Increasing training success, the vagina will close the urethra again. The bladder level will rise and will be positioned again almost horizontal to the vagina. Receptors lose their contact to their neighbors and no longer irritate each other. Of course, periodical signals from the bladder receptors tell about the adequate fill level. According to the gate control theory, for example, chronic inflammation of the bladder leads to confused signals because of constant stimulation of the receptors. Starting from a certain amount of signals, those will be passed on to the brain through the spinal cord. The result is a reflex emptying which can't be suppressed. The low frequency and rhythmical pulsations of transpelvic magnetic stimulation interrupt this signaling. So the micturition reflex will be reduced. Both the integral theory of Petros and the gate control theory confirm the effect mechanism in case of stress and urge incontinence. Further application fields are the mixed incontinence, fecal incontinence, as well as the stress incontinence after a prostatectomy. An application needs only 16 minutes, and it is a perceptible and stimulating experience for the patient. The Pelvi Center offers optionally 3 additional benefits. Almost 3/4 of all incontinence patients suffer from depressive symptoms. This burdens the compliance and also the therapy progress. Light therapy is a therapy standard in case of seasonal depression, but also in case of major depression and even in case of reactive depression. Light therapy also increases wellness and performance in healthy people. 10,000 lux, a perfect summer day without any harmful UV influence. The stimulation of the pelvic floor corresponds to intensive muscle training because it includes the main muscle groups of the buttocks and the thighs. Here, the scientist Manfred van Ardenne has found an interesting physiological phenomenon. If you activate the muscles and the circulation at the same time, the current oxygen partial pressure will not only increase, but it will improve. Moreover, via reducing the swelling of the endothelium, the capillary flow is also improved. This also happens continuously after the application. Like every demanding exercise, the intensive muscle training of the trans-pelvic magnetic stimulation involves stressing the whole person. QRS optional frequency therapy from a chosen area of the brainwave spectrum calms the patient's mental state into a relaxing alpha rhythm. The Pelvi Center Quattro, the perfect incontinence therapy in 4 logical treatment steps, with an also defined effect on the erectile dysfunction of men and the orgasm ability of women.